Let's take a look at how the ocular surface is.
Moderate to severe dry eye can be caused by a number of factors, and your healthcare provider has prescribed Lacrisert to help you treat your symptoms.
The surface looks nice and clear.
Lacrisert, also known as hydroxypropyl cellulose ophthalmic insert, is a unique treatment option. Lacrisert comes in a 60-dose box with a flexible applicator. Each 5 milligram dose is individually sealed in a sterile blister pack.
We look at the patient who is using their artificial tears more than 2 to 3 times a day. There's a number of issues when a patient has to use multiple tears throughout the day, the compliance issue, the hassle factor for the patient. And in addition, we worry about preservative toxicity. Most of the artificial tears that people use are in bottle form, and they have preservatives, and that can lead to ocular surface problems.
Not only is Lacrisert preservative-free, Dr. Bruce Koffler says it provides convenient relief and continual comfort.
The obvious advantage of using the Lacrisert over eye drops is that it is continuously dissolving, whereas the eye drop you'll have to put in multiple times throughout the day, which is both inconvenient, difficult to remember, and also tends to kind of mess up any eye makeup that you may be using.
While Lacrisert is not for everyone and only your doctor can decide if it's right for you, it's worked for Janie, who was diagnosed with chronic dry eye in 1991.
It looks like your tear film appears to be normal looking today. And
she's a bookkeeper, and she says staring at a monitor makes her symptoms even worse.
And I spend a good deal of the day looking at computer screens or reading reports. And without the Lacrisert, my eyes would be very dry and they would ache and burn. And I would just simply want to close them and tell the world to go away, but can't make a living like that. Probably lose your job. So with the use of the Lacrisert, I'm able to have my eyes moist all day.
We're going to show you how to properly insert Lacrisert. Much like wearing contact lenses, it takes a little practice. First, wash your hands thoroughly and dry them. Remove the applicator and make sure it's clean. You should rinse it under hot water and shake off the excess before each use. Carefully open the blister pack on a flat, clean surface. Don't be surprised at how small it is, smaller than a grain of rice. Pick up your dose of Lacrisert with the applicator, then gently grasp open your lower eyelid and place the dose deep in the pocket called the lower cul-de-sac. Once you insert the Lacrisert to the inside of your eyelid, it should come off the applicator. Let your eyelid close as usual. You may or may not feel what is called a foreign body sensation when you start using Lacrisert. That's the feeling you have something in your eye. If placed properly, it should not be uncomfortable. Again, just like wearing contact lenses for the first time, for some people it takes a little getting used to. Be sure to carefully read the instructions provided and, if possible, practice inserting your Lacrisert while still in your doctor's office. If improperly placed, Lacrisert may result in a corneal abrasion.
It's really not difficult, and a lot of people say, "Oh, doesn't that hurt?" And it really doesn't hurt. You don't even feel it.
Once the Lacrisert is in place, it starts to dissolve.
Lacrisert typically starts to dissolve almost immediately. I've had it in my own eye, and it's a remarkable product. Initially, you can hardly feel it, or maybe you might have slight irritation from the Lacrisert, but almost within the first 5 or 10 minutes it begins to dissolve.
During the day, by retaining moisture either from your own tears or from artificial tears, Lacrisert becomes a reservoir, lubricating your eye in a soothing and protective tear film. Lacrisert contains no preservatives.
So let's take a look at you today.
This means people who are sensitive to preservatives may experience relief from their dry eye symptoms without the potential risks associated with common eye preparation preservatives. Because severe dry eye is often treated with more than one therapy, your doctor may prescribe Lacrisert along with other medications.
I used a lot of eye drops for a good decade there.
Lacrisert should not be used by people who are hypersensitive to hydroxypropyl cellulose, which is the active ingredient of Lacrisert.
Once you start using the Lacrisert, you will feel some relief for the first day, but you'll get more effect as the first week and 2 progresses on. The reason for this is that the Lacrisert will begin to aid in healing the ocular surface for some of the dry spots that you have.
Come up to the mirror. We're going to put it in your left eye.
So hold it with your right hand.
You can feel confident using Lacrisert because it has been on the market for many years. Both its risks and benefits are well known. You should follow insertion and removal instructions carefully.
Back. Push it inside a little bit deeper. Beautiful.
Common side effects were mild and temporary. They include transient blurriness. You shouldn't drive or operate machinery until the blurriness goes away. Some eye discomfort or irritation, matting or stickiness of the eyelashes, sensitivity especially to light, edema or swelling of the eyelid, and hyperemia or bloodshot eyes. Improper placement of Lacrisert can lead to corneal abrasion.
Lacriserts will work for up to a 12 to 24-hour period. We find that some patients just need one Lacrisert during the day. We find other patients like to put a second Lacrisert in during the day.
Take the tip and pick up the Lacrisert, and then we're going to move to the mirror right here. And I'm going to ask you to take the Lacrisert in your hand.
If possible, you should use Lacrisert for the first time while you are still in your doctor's office so that they can help you learn how to insert it. At the end of the day, much as you would with contact lenses, many patients like to remove Lacrisert before they go to sleep. This can usually be done by taking a clean tissue and pressing gently on your lower eyelid to expel any unused Lacrisert. Then just throw the tissue away. For more information about the causes and treatment of dry eye, ask your healthcare provider or log on to Lacrisert.com.